Hi guys, welcome back to my channel. In today's video I'm going to be talking about my surgery that I had and a little bit about it, how I'm doing, a quick update. So the surgery that I had is called a core decompression, and we also did a right knee arthroscopy, which they basically put a camera and look around, and I have some pictures, but they're in my other room and I'm in my studio, so I can go ahead and maybe insert some pictures and maybe talk about them. But you know, they went ahead and did a quick check in my knee just to make sure the knee was healthy and to check how the bone is doing, to check the muscles, the ligaments and everything. So they took some pretty amazing pictures of my knee, and I was shocked to see those pictures. It's amazing how far technology has come, and especially medical technology. It's just amazing what they can do with our bodies and, you know, with medicine and stuff. So I basically had a core decompression with a bone marrow aspirate injection. I think that's what it's called. So they basically take my bone marrow out of, well, they took it out of my upper hip area, and they went ahead and injected that when they did the core decompression. Well, let me kind of back up. The reason I needed to get this surgery done was because I've been complaining about a lot of knee pain, and my knee has been cracking, making weird noises. I sound like the Tin Man making all these cracking noises, and on top of it, it's just been super painful. I can't go upstairs or downstairs. If I take any sort of stairs, it'll really aggravate my knee. So in my school, we have so many stairs. So I have to try and take the elevator or walk a longer distance to get around the stairs. Before, I used to be able to pretty much take stairs and, you know, feel somewhat comfortable when I was walking up them, but I was getting a lot of pain, you know, I was thinking it was sickle cell crisis, and some of it was, you know, you do get a lot of knee pain and joint pain, but they discovered when they did a CAT scan or an MRI, I can't remember which, that I had some bone death in the knee. So part of my bone in the knee was basically dead. The measurement of the area that was dead was around 13 mm is what they said at the time. I don't know if it died anymore since then because we haven't had any recent MRIs, but that was the reason that I needed the core decompression, because there's really no like cures or procedures that can be done when a bone dies. When your bone dies, it's kind of really hard to, you know, revive it and save that area. So what they do with this surgery is they take a drill and they drill directly towards, you know, the area that's affected. So they go and drill into that area, they take out the dead bone, and then they inject your bone marrow to help generate that bone growth. Now, I don't know if it's gonna grow. We're still in the not too sure stages. You know, it'll take some time to start generating that growth, and we need to see how it's going to work. But like I said, there's no known like procedures or medicine or anything that you can really do other than this to help the bone. If I did not do anything, if I would have decided not to do the surgery and to, you know, leave it untouched and, you know, go on about my day, I still would have been in pain, which even though I have surgery now, I'm in a lot of pain. I feel like I'm in more pain now. I don't know if it's because it's very aggravated because of the drilling and the poking and the stitching and all of this stuff that happened. But, you know, the doctor said it's gonna be a lot more painful from the surgery. But if I wouldn't have done anything, the doctor said, you know, your knee can kind of collapse because your bone starts dying, and, you know, essentially you can get a little fracture and your bone can just collapse, it can break, so many things can happen. So right now it's basically, in my terms, what I call a bandage. We're putting a bandage or we're basically patching a hole in the wall. It's kind of, that's how I would describe it in simplest terms so you guys can understand. You know, imagine if you have a hole in the wall and, you know, you're tired of looking at it, so you're gonna go ahead and put a nice patch on it. The hole essentially maybe through the back part of your wall may be still broken, but the outside is going to be patched pretty, you know. That's kind of how, you know, they drill, add that bone marrow and hope that's going to stimulate some growth. On Tuesday, or this past Tuesday, they removed my stitches, and it had been around 2 weeks since I got my surgery. So I had to wear like this stretchy band around the leg. It's kind of like when you twist your ankle and you put like an ace band. That's basically what it is. And then they put a big white stocking over my leg, and that white stocking was supposed to prevent any blood clots because I do have sickle cell. They wanted to make sure that I didn't get any blood clots because of the surgery or because of the sickle cell, so I had to wear that stocking like 24 hours a day, and for about 2 weeks I had to wear that, and it was a little tight, it was uncomfortable, and the only time I took it off was to take a shower. So now I don't have stitches, and now I don't have to wear that stocking, thank goodness. But I do have like a band, the ace band. I think that's what it's called, an ace band. And I do have like little tapes covering the incisions. And then I have like a gauze on top of it and a tape on the top. I have like 3 incisions on my knee and then a 4th one on my hip from where they retrieved the bone marrow. So like I did mention, the pain for me has increased. I've been having a lot of pain. My knee was so swollen. Your leg received this trauma to it. So for me it was very swollen, and some of the swelling started to go down. So now the knee isn't as swollen as it was, but in certain parts, like on the side of my knee, it's very swollen and it's very tender still. I mean, if I bump into anything or if my dog will try to like climb on top of me, it's very painful still. It's only been 2 weeks, and the healing process, it's gonna be a little slow. So the doctor said that the bone itself is pretty healthy, it's nice and smooth, the muscles, the ligaments, all are pretty normal, except that bone death that I did have. So it's great that I'm not having any other like bone death in like the kneecap. That was amazingly smooth. He said it looked perfect almost. And I did notice my ankle and my foot are swollen, so it's amazing that the swelling kind of just went down. I also noticed that the back of my calf got smaller because I'm not putting any weight on it. So I'm supposed to use crutches for 6 to 8 weeks. And since I'm using my other leg, that other leg is getting stronger, and the leg that they operated on, which was the right leg, is getting a little bit weaker. So I will be doing physical therapy in about a week or 2. I do try to touch the floor with my toes and move my toes around a little bit so they can get some movement and circulation. Of course, I'm not stepping on it completely, but like when I sit down, I try to kind of move my ankles around and, you know, move them up or down like this. I try to put my knee elevated to get the swelling down, especially when I sleep. I try to put a pillow underneath. But overall, I feel like I'm healing slowly but surely, which is a good sign. It doesn't appear that I have any infection. I am healing slowly but surely. I do have about 4 to 6 more weeks on crutches. I'm hating them, but you know, you gotta do what you gotta do. But yeah, that is how I'm doing for this week's Sickle Cell Sunday, how my surgery went, a little bit about the core decompression. You know, this is gonna be a pretty short Sickle Cell Sunday video. I just really wanted to update you guys on how I'm doing and how I'm feeling, and I want to keep the videos a little bit on the shorter side, especially because I'm not feeling well and I have a lot of schoolwork. If you have any questions on the core decompression, or if you've had a core decompression, let me know how you are doing and your story of your core decompression. If you don't mind sharing, please let me know how you're healing. Anyways guys, that's gonna be it for this week's Sickle Cell Sunday. Please let me know if you have any further questions or comments. And thank you so much for watching. Please remember to check out my Facebook, Instagram, Snapchat, and I now have a Twitter. So go check out my Twitter account. It'll be listed down below in the description box. And as always, I'll see you in the next video. Bye guys. Don't forget to check out my Facebook, Instagram, Snapchat, and now Twitter. Follow my mama on all of the social media and it will be listed down below in the description box. Check it out guys. Angel, Angel, hi mama. Oh, she's sleepy. It's literally like midnight.